Do you suffer with muscle knots in your neck, shoulders, or upper back that never seem to go away, no matter how much you massage them and work on that tissue? Well, if so, then this is the video for you, because I'm about to share with you a simple 3-part strategy that you can use to get rid of the pain, stiffness, tension, and burning and fatigue that you deal with once and for all. Let's get into this. Over the years, I've noticed that patients who come into my clinic complaining of these types of problems have certain characteristics in common. From a structural standpoint, they tend to all have a forward head position. They also tend to have excessive rounding of the middle back, known as a hyperkyphosis, and very often they have internal rotation of their shoulders, where the chest is actually collapsed inward slightly in conjunction with that excessive rounding of the spine. On the functional side of things, they tend to have extreme difficulty with the ranges of motion in their neck. I'm talking basic movements like turning your head, side bending, looking up at the ceiling, and down at the floor. Those can be limited in their range, and very often they are extremely uncomfortable and even painful. Now, if that sounds like you, I've got just the thing for you. The first step in this process is to release any muscle imbalances that are contributing to your structural dysfunction. The second step is to restore normal position of your head, and the third and final step is to build the strength and stamina that's required to hold you in an optimal position all day long. The first step in this process is to release and open up the big, powerful flexor muscles here on the front part of your torso. Now, there's a chain of muscles that runs from the palm of your hand up the inside of your forearm, across your biceps, the front part of your shoulder, your chest, and down the muscles on the opposite arm. And these muscles tend to be super short and tight in anybody that has the posture that I described earlier in this video. Now, the great thing is that we can release and open up all of these muscles at the exact same time with a simple stretch called the door stretch. The only equipment that you're going to need for this is a door. Once you've got that, you're going to position yourself slightly in front of the door frame, and then you're going to extend your arms behind you, wrapping your fingers around the back side of the door frame. The door frame itself should be sitting here in the middle part of your palm, and your thumb should be completely clear of the frame and on the same side of the door as your torso is. One of the most common mistakes that I see when people are setting up for this stretch is that they have a tendency to position their entire hand behind the door frame. They're almost like hooking their wrist at the door frame, and that really limits the effectiveness of the stretch. So you need to make sure that the door frame is sitting right there in the middle part of the palm and the thumb is completely clear. Now, you're going to start off with the hands positioned low in the door frame. That's the beginner position where you're limiting the amount of stretch that you're going to get. This is a very safe position to start from. From there, you're going to push your back leg behind you through the door frame. Front leg is going to extend out in front of you, almost into like a lunge position, and then you're going to bend your front knee slowly, applying weight, and you're going to start to feel a stretch across the front part of your shoulders and maybe across your biceps and the inside part of your elbow as you load this stretch. And once you find the limit of your comfort zone, just hang out there. What we're looking for is 45 to 60 seconds of continuous stretching. If you find that in that time frame you become very comfortable, just bend that front knee a little bit more and you're going to get more load on the stretch. What you should feel is that your chest is just becoming more prominent and pushing more and more out in front of the shoulders. Now, it's important that you monitor your head position while you're doing this stretch. You want to make sure that the chin stays tucked and the neck stays as neutral as possible. Remember, we're stretching the muscles on the torso, not the neck muscles. After that 45 to 60 seconds, ease yourself out of the stretch. Now, like I just said, the position that I just showed you is the beginner position with the hands placed low in the door frame. You're really limiting the amount of stretch that you can get. If you want to make this stretch more intense or get a deeper stretch into those muscles, what you need to do is from that position you started in, just slowly kind of walk your hands up into the door frame and then come into the exact same position, loading weight by bending that front knee, and you're going to find that you're going to get a much deeper stretch the higher your hands are positioned in the door frame. Now, ultimately, you're looking for that 45 to 60 seconds of continuous stretching across that entire chain of muscles, and you should perform this 2 to 3 times a day. The second part of this process is to make sure that your head is pulled back into a normal carry position. Now, normal position of the head means that when viewing the body from the side, the whole of your ear should be stacked directly over the center point of your shoulder. Now, I want you to see this patient who came into my clinic and take a look at where his head sits in relation to his shoulder. Notice how the head is pushed way out in front of his body and that excessive rounding in his upper back. Now, what's happened here is that the normal curve in this person's neck has been reduced or even reversed and pointed in the wrong direction to allow his head to get that far forward. Now, as a consequence of being in this position, this person's head has actually increased in functional weight. It's much harder for his muscles to hold his head when it's poking out in front of his body like this. And so those muscle knots and chronic tension that this person is experiencing in the base of his neck here and in the muscles in his upper back will never go away until we can reduce the strain that's being placed on those muscles as a result of being in this position. And so we need to get the head back, and in order to do that, we need to push the normal curve back into his neck. Now, the most effective way of doing this is with a technique called active traction. And to perform active traction, you're going to use an active traction unit. You're going to slide on this weighted headband, which has a concentrated load here in the front portion of the band. Now, what this does is it gently pulls you into this position. And as it's pulling you down, your body does this amazing thing where it counteracts that downward pull. So it kicks on the muscles across the whole backside of your body, even down into the little muscles of your feet and your deep neck flexors to pull you in the opposite direction that the band is trying to take you. This is a counter pressure response, and it happens at the subconscious level, which is the same level that your posture is regulated at. So this subtle pull is pulling me down. I'm pulling upwards to counteract it. And we've got solid scientific research from multiple studies showing that performing active traction for as little as 5 minutes a day can significantly reduce forward head position and put the normal curve back into a person's neck. Now, I did a whole video on just this subject, and I'm going to put a link for that here. I strongly recommend that you check that out if you struggle with chronic neck pain, headaches, or those knots in your upper back that never seem to go away. The third and final step in this process is to begin building the strength and stamina that you need to hold yourself in an upright posture all day long. Now, the thing to keep in mind here is that the muscle fibers of your postural uprighting system are primarily slow twitch fibers. They're involved in endurance type activities, which makes sense, right? Posture is the ultimate endurance activity. We're not talking about doing repetitions of bicep curls here. The postural muscle's job is to hold you in upright posture without ever taking a break all day long. And that's how we want to train these muscles so that we get maximum carryover effect. So the exercise that we're going to be doing here is an isometric exercise, which means rather than moving back and forth through a range of motion, we're just going to pull our muscles into a position against resistance and then hold that resistance for a period of time. Now, the only equipment that you're going to need for this is a resistance band. Once you've got your band, you're going to take it with an overhand grip as if you were riding a bicycle. You're going to extend your arms straight out in front of you at shoulder height, and then you're going to pull apart as if you're trying to tear that band in half. Now, rather than doing a traditional pull apart where you're bringing the band all the way to your chest, what you're going to do is you're going to pull about halfway there till your arms are about 45 degrees of angulation off the sides of your body, and then you're just going to hold it in that position, consistently trying to pull apart, but never going any wider than this. Now, if you really struggle with this, you can start with as little as 5 seconds. But if you're good at it, you can build up as high as 45 seconds and just hold that resistance. Now, you can see here that my arms are shaking even with me being used to performing this movement. Now, there are a few modifications that you need to know about. First and foremost, you can make the exercise as easy as you want by modifying the size of the resistance band that you're using. Now, these are body elastics, and conveniently they let you know right on the tab how much resistance you're working with. So if you find that the exercise is too hard for you, just select a lighter band. Now, alternatively, if you only have one band available, where you grip it will also determine how much resistance you're getting. So if you grip very close, you're going to get a ton of resistance, whereas if you grip very wide, it's going to be significantly easier. So those are two ways to modify the difficulty. Now, as you get better at this, you may start off with just one set of 5 or 10 seconds. As you get better, you could add a second set. Ultimately, you want to build up to the point where you're doing 3 sets of this per day, somewhere in that 5 to 45 second range. Once you get really comfortable with this and you're up at that higher end of the range, then you can add a layer of difficulty to this with dual tasking. So you would come into your isometric pull apart position and you would add a standing march to it. This way you're getting those postural muscles adapted to being able to hold you in that upright posture while you're moving around all day long. Adds a layer of difficulty and trains you for the real world application. The topic for this video was a suggestion from viewers just like you. So if there's a specific pain, posture, or rehab related topic that you want to know about, leave a comment in the section down below and I'll make a video about it. You can check the description for links for the active traction unit, my favorite type of resistance bands, body elastics, and the exercise balls that I recommend. Before you click over to get those, make sure to give this video a thumbs up, share with any of your friends that are suffering with these problems, and subscribe to the channel so that you're updated every time a new video comes out. That's all for now. See you next time.